unseres Tagesprogramms Digital Health Joint Vision for European Citizens and Patients. Wir werden jetzt uns noch mit dem, sorry, I switched to English again. We will now deal with the important issue of a trained eHealth workforce. And it's my pleasure to welcome virtually, and I think we will see a picture soon. Okay. Our first speaker, she will speak to us from Chicago, and Toria, she works for HIMSS North America, and is in particular they're responsible for the Tiger Initiative, which stands for Educational Reform. And we collaborate with Toria and HIMSS in the project that will be presented later on in more detail then. It's the EU-US eHealth Work Project. And this will be presented by the coordinator, Rachel Blake. And we are very proud that the Commission is with us, Terje Petzo, who is Head of Sector eHealth and Aging Policy in Unit H3, eHealth Wellbeing and Aging in DG Connect. And this unit is actually funding the EU-US eHealth Work Project. So they are, of course, experts in the matter and also in doing quite pragmatic steps forward to safeguard education for these tasks of digital healthcare. So I'm not sure how I could now find out whether Tori is hearing us. Maybe we could hear her on the loudspeaker system. Tori, can you say hello to us?
Hello, good afternoon, everyone. I hope you can hear me.
Yes, perfectly well. Great. So,
wonderful.
Tori, yes?
So I'm happy to start whenever you'd like.
Yes, let me just, I will just add one sentence, then it's up to you to start. We have actually prepared, just for the audience here, we have prepared a WebEx session which is hosted by Tori. So she will demonstrate her slides in a second remotely via WebEx. And as you have noticed, we are connected with an audio line. So after the presentation, there will be an opportunity to have questions. And afterwards, I will invite the other speakers here up to the stage. So Tori, it's up to you.
Okay, wonderful. Thank you so much. It's my absolute pleasure to be with all of you remotely from Chicago in the United States. So as Stephan shared, my name is Toria Shaw. Everyone calls me Tori, and I have the honor of serving as the Senior Manager of Clinical Informatics with HIMSS North America. HIMSS stands for Healthcare Information and Management Systems Society. So in this role with HIMSS North America, I really focus in on all things Tiger, which stands for Technology Informatics Guiding Education Reform, as well as Tiger's most robust resource, our virtual learning environment. I also have the honor of serving as Tiger's project team lead for the EU-US eHealth Work Project, which you'll all be hearing about in depthly today during today's program. So Tiger, just a brief overview, began as a grassroots initiative within the nursing community. It's dedicated to advancing the integration of health informatics to help transform both education and practice. Tiger was previously a standalone foundation that transitioned into the HIMSS organizational structure in September of 2014 and is supported by our clinical informatics department. With this transition, we shifted to a new interprofessional, interdisciplinary approach as our pioneers realized that everything we're doing in terms of resource development, research, research is really applicable regardless of discipline. And I just wanted to share a little bit about HIMSS with all of you. I'm sure you all know about HIMSS, but briefly, HIMSS is a cause-based global enterprise producing health IT thought leadership, education, events, market research, and media services around the world. We were founded in 1961, and we are headquartered in Chicago, Illinois, in the United States. But we also serve the global health IT community with additional offices throughout the United States, Europe, and Asia. Many of you may know about HIMSS because of our annual conference. It is one of the largest and most important health IT conferences in the US, with just over 40,000 in attendance annually. And in fact, our next conference will take place in Las Vegas, Nevada, next March in 2018. So today, Tiger is really a stable grassroots initiative that is focused in on education reform, fostering international community development, and most recently, global workforce development, utilizing this interprofessional approach that I talked about previously. So here at HIMSS, we do have an interprofessional community that Tiger is supported by. We have a committee that is guided by Dr. Beth Elias, who's an associate professor at the VCU School of Nursing in Virginia, and Dr. Ursula Hübner, who's a professor of medical, health informatics, and quantitative methods at the University of Osnabrück in Germany. They serve as our co-chairs. And then just under our committee, we have a special project subcommittee that's focused in on our international projects, a VLE subcommittee that's focused on our educational platform. We also have an international task force as well as a scholars work group that provides an educators community to enable us to share best practices and knowledge to help advance the informatics discipline. So as I shared, we do have an international task force. So Tiger is represented by 24 countries worldwide. And this began in 2012 with the vision of really expanding Tiger globally to help support academic professionals, students, adult learners, and clinical educators. Our liaison to the task force is Siobhan O'Connor, who serves as a nursing lecturer at Edinburgh Napier University in Scotland, the United Kingdom. I want to share a little bit about Tiger's International Competency Synthesis Project. This project kicked off in 2015 and works to highlight recommended core competencies in informatics as we recognize the role of education as a powerful enabler as well as a change agent. So based on this recognition, Tiger continues to focus on maximizing the integration of technology and informatics into seamless practice education as well as research resource development. So we began this project in 2015 by deploying a survey to help us prioritize and evaluate a broad listing of core informatics competencies. And then we compiled national case studies that focus in on local perspectives as well as touching upon core informatics competencies within 5 domains: nursing management, IT management, quality management, interprofessional coordination of care, as well as clinical nursing. And lastly, we use this information to help us populate a recommendation framework that outlines both shared as well as country-specific competencies. So this project really the goal was to discover competencies and skills that are needed within this global health informatics workforce. So I do want to point out this project actually served as the basis for us to begin the EU-US eHealth work project as we leverage some of the project findings as well as case studies. So this just kind of shows what the building blocks look like as it went into our recommendation framework. So based on these project findings, priorities really are helping healthcare professionals to better meet the requirements of an interprofessional process and outcome-oriented way of providing modern care. This is a new publication that Tiger recently released. It's called The Evolution of Tiger Competencies in Informatics Resources. And I'm referring to this because it really does a wonderful job of sharing where Tiger is in terms of all of our global projects, our research, utilizing this interprofessional interdisciplinary approach. It highlights the European computer driver's license. It also talks and really provides in-depth details about the Health IT Competencies Tool and Repository known as HITComp. It goes into in-depth information about our virtual learning environment, as well as this competency synthesis project. It also shares the recommendation framework. So if any of this information is of interest to you, I would encourage you to visit us online at HIMSS.org. In our library, you would be able to download this really important resource for our global community. I talked about the VLE just really quickly. The VLE is a dynamic and unique one-stop education portal for our target community, which is academic professionals, students, adult learners, as well as our clinical educators. It's really designed to take a user from A to Z in health IT. It has resources that are vetted and reflective of these international competencies that I've discussed. So if you'd like more information, please visit www.hims.org/Tiger. And now I'd like to just really quickly share more about Tiger's role in the EU-US project. I know that our project coordinator, Rochelle Blake, is with you all live today and will really provide a comprehensive overview into the project. But I will just share a little bit from Tiger's perspective. So as all of you know, we were most of you, some of you may know, but we were co-awarded funding last September of 2016 from the European Commission's Horizon 2020 Research and Innovation Grant Program to work on this really dynamic EU-US project. So this project is really an incredible opportunity for both HIMSS and Tiger to be able to collaborate with all of our European project partners and stakeholders such as yourselves on this really important international level. So as a member of the consortium, we're really working to transform healthcare through the infusion of information technology into workforce development. So to do this, we are mapping, quantifying, and projecting the need, supply, and demand for competencies and for developing IT skills. And we really feel like this will be taking us closer and closer to realizing both a trained and skilled transatlantic eHealth workforce. So as I shared previously, we did use some of our findings as well as case studies from our International Competency Synthesis Project to help us with a baseline to begin our work. And then we're also going to be leveraging the Tiger Virtual Learning Environment with the development of an interactive website platform, which will be debuting next spring of 2018. So Tiger's role in this project really goes hand in hand with the University of Applied Sciences in Osnabrück, Germany, as we have been responsible for large segments of the work plan. So we kicked things off by hosting an EU-US collaboration networking event last year at HIMSS 17 in Orlando, Florida. And there we shared a white paper that really details our project. And we are in the process of making an update to this white paper in time for HIMSS 18 in Las Vegas next March. And we'll also have that updated white paper available online. And then early this year, we finalized a survey that was deployed on February 14th. The survey really served as the flagship of our project, as it really helped inform all of our deliverables that came afterwards. So this really helped us figure out the gaps, needs, and trends within this global workforce. And then based on findings from both the survey, we conducted a gap analysis, and that information is now helping us bring to life case studies that will speak to both the survey and our gap analysis findings. They will highlight disparities in health IT skill set, as well as available curriculum and workforce training programs, skill assessment tools, as well as speaking to both educational needs trends and future state mapping for the transatlantic workforce. And I also want to call out that we are currently in the middle of an open call for case studies that are really focused in on the European Union. So if you are interested in joining us in this project endeavor, I would strongly encourage you to reach out to us. Right now, we're focused in on Eastern Europe and the Baltics, the Mediterranean, as well as Scandinavia. And in order to aid this development process, we're providing an exemplar case study template, as well as a development template and a checklist. Case studies may be developed in local language, and then they'll be translated into English once they are finalized for publication inclusion. All contributors will be listed as co-authors on future publications. I just also wanted to share a few ways to get involved in Tiger. If you're interested in learning more, I definitely encourage you to sign up to our Tiger listserv. That is tiger@list.hims.org. We also have a virtual learning environment webinar series that's designed to get to know leaders in the health IT community worldwide, and that is a part of our virtual education environment. So if you're interested at all, reach out to me. And finally, HIMSS does a really great annual call for committee volunteers for HIMSS members. So I know that there are many members of HIMSS that reside in Europe. If you're interested in getting involved with Tiger, again, reach out to me. It has been my pleasure to briefly share about Tiger and our role in the EU-US eHealth Work Project. My email is tshaw@hims.org. If you have any questions or you'd like to collaborate, please feel free to reach out. Thank you so much, Stephan.
Thank you, Tori. Thank you for the clear presentation. All was well understood. Technology worked very well. So, as I understand, you will stay a little bit on the line. Do we have a question here in the room for our speaker? Okay, this is quite not the case, so I would like to welcome now here on the stage Teria Pezzo of the European Commission. Or you will maybe directly go to the lectern. And Terje will now speak to us on the title EU Digital Skills Initiative as Enabler for Safe and Reliable Digital Health.
Thank you very much for the invitation and for all these great presentations throughout the day. And very much, many thanks for those who are still at the final session of this workshop here. I don't have any slides, so I'm completely opposite to the previous speaker who was so virtual with slides and with the person. So I would just like to share with you a few points from the Commission perspective on what we are doing in terms of improving the digital skills. And I would like to go a bit broader than only the health workforce. I work in DG Communication Networks, Content and Technology, where we have a unit called eHealth Wellbeing and Aging. And in our unit, we mainly contribute through the research projects or through the certain policy areas that actually take place in DG Connect to the further large-scale deployment of eHealth in Europe. So in our portfolio, there are two types of actions. One is to contribute to the policy where we see that our area is certainly important, like, for example, on this digital skills and jobs coalition, where health workforce is as any other area of competence where it is needed. And secondly, of course, we support funding of the research projects and also through the Connecting Europe facility that was discussed previously in previous sessions as regards the patient data exchange. So this Digital Skills and Jobs Coalition, which also foresees health as one of the areas of work, was launched in 2016. And since then, I'm happy to say that already 7 million workshops, training courses have taken place to educate people digital skills. Because healthcare workforce is as any other people who need basic skills, and then further, according to their needs, on the jobs that are more in-depth skills that they are looking for. And also, we have now in this coalition more than 190 members, which is also quite significant to demonstrate the interest in working together, doing the network learning and sharing. And by now, 18 member states have actually developed their strategy on how to improve in their country the digital skills in the population. Because the fact is that we have 44% of European citizens who do not have currently sufficient digital skills, and 73 million of people who don't have any skills at all. And don't think that this is all in the age group of 50 plus. Because I can tell you, my mother, who is 81 years old, is using very effectively all kinds of digital tools because she has understood the benefits. Paying for internet allows freely speak to children living abroad, to be in regular contact with grandchildren, to monitor the news or to share the photos through the emails. So this is very important that all this is framed in this understanding of benefits. And I think that is something which, in addition to these digital skills, is very important for the health workforce as well. They have two important items that we have to keep in mind. First is the awareness raising of the benefits, that they know why it is good for them. Is it good because it is improving the health outcome of patients? Maybe it helps to get faster to the diagnosis. Maybe it helps to save time. Also, in the beginning, it always seems opposite, but in the time being, it is improving to save time. Maybe it is improving to save the resource in terms of financial, and not necessarily that you will save time that you can use somewhere completely different, but it can improve using the resources of healthcare systems inside this much better and to provide better service for more people. So all these benefits thing is kind of as in the previous session, someone said that you need a narrative in order to develop the strategy. You need this in order to develop a strategy, the need. And the second very important aspect is that in the development of digital tools, we have to involve the end users, so that it is not that people with the high IT skills will develop something and then they give it to you and say, use it. No, it has to be user-friendly, first of all, and it has to meet the needs that this end user has. So in our research projects, this requirement is really quite important, that end users are involved, not at the stage when the product is ready and going to the market and then you fail, but from the first stages of development. So these benefits and the skills, they really have to go together, the end user's involvement, and then we can really build on somewhere bigger and expect better outcomes. I am very happy to say that yesterday, European Commission presented actually its vision to come up with the plan about how the European education area should look like by 2025. And one of these 11 areas of work, which was mentioned, I can't say that it was the first or last, but they were all equally important, all these 11, was to mainstream innovation and digital skills in an education. So that if I look at my children, then I have a feeling that they have born with this blind 10-finger system of typing on the keyboard. I don't never remember that they have been taught about that or learned it, but they somehow managing it naturally. But we need, and education is not only until age of 18, education is throughout the life. So we have to learn new skills all the time. We have to implement new tools every day, and each and every new development in digital health has to come with the training. That is also something that we clearly have to keep in mind. Going closer to the next speaker and bringing it more to the work that we do in DG Connect in our unit on eHealth. Yes, in 2010 was signed the Memorandum of Understanding between the US and the European Commission on eHealth. And it is on the 3 work streams. First 2 from 2010 were cooperation on interoperability and on workforce skills. Then in 2016, this Memorandum of Understanding was revised and the 3rd stream was added, and that is on cooperation on ecosystems. So on the both interoperability and on the workforce skills, we have supported this through the funding from the Research and Innovation Program. On interoperability, we had a project Trillium Bridge and Trillium 2 now ongoing. And on workforce skills, we first had a project CAMEI, which looked into the needs of digital skills and what the real skills actually are in 4 different European member states, and mapped the needs and what should be done in order to go further with that. And now we are from Horizon 2020, currently ongoing project is the EU-US work. So that is something that the next speaker will tell you in more details. But in principle, I would say that you can see this health workforce digital skill quite narrowly, as it is in this project that is very specifically focusing on that. And for example, under this digital skills and jobs coalition, we have set up a network, which is an international network for health workforce education. So it can be very workforce oriented, but it also can be seen quite broadly in the context of other activities on the digital skills going on in Europe. Thank you very much. I certainly didn't go over time. So I hope that if you have any questions, I'm happy to answer.
Thank you very much, Terje. I'm coming up to you. Just looking for the best shortcut. So, any questions to Terje right now? Okay, but Toria had presented this virtual platform from HIMSS. Do we have something similar already in Europe? Okay.
I think that Rachel will speak about that in her presentation about the platform.
Lucky to hear that our project has the only one. Good, okay, that's very good. Okay, so then let's move on without delay to our next speaker. Just looking up the title, it's on future-proof eHealth skills in the global health workforce, implementing results from 5 years EU-US collaboration. So Terje already kindly made the point on the EU-US Memorandum of Understanding, and so Rachel will now, let's say, tell the most recent part of the story, the recent continuation from the memorandum on behalf of the education in our joint project, the EU-ES work project, where she is the coordinator, and she's also CEO of OmniMicro and OmniMed Solutions here in Germany, but also with another business instance in San Francisco in the US. So Thank you very much for coming to us. And if I missed something in your in the introduction, please add it. I'm a little bit tired at the end of the day. Okay.
Thank you, Stephan. And Stephan is one of the members of our consortium as well through Tiger, through eHealth, as is Toria. So let me make sure I have this correct. Yes, excellent. So we'll go through this. There are a lot of slides. We'll go through them pretty quickly, but I want to introduce you to our project today. As Terry has spoken to, and as well as Toria. So you've been kind of preparing for this all day, listening to how we're really working toward things such as interoperability, and to achieve things like this, what you need is a skilled eHealth workforce. So what we're going to do is we're going to examine the results of what we've done recently, our flagship survey that we've completed for our project. We will learn about the latest tools and resources that we're creating, which is really a large portion of our project. And then finally, we'll investigate how you can get involved in this important initiative. We still have quite a bit of work left to do, and we still are really seeking stakeholders to participate in our work. As Toria has spoken about, we are looking for case studies. We are also looking for reviewers for our foundational curricula, which is finishing up, and I'll tell you a little bit more about that as we continue. So you've been hearing about this all day. Digital services in healthcare cannot be deployed without those skilled workers. So what we have found and what we have been finding in our, not only in our research and in our surveys, but these digital skills are not often taught with the traditional health provision skills, such as those in health sciences, anatomy and physiology, pharmacology, etc. So what needs to happen is these need to be taught concurrently, and we need to make sure that the eHealth providers are not only educated but are skilled. They have the skills to do the work that they're presented with from day one. So when we look at skills, they're taught at a level, but not necessarily the level for their role. So what we're finding is that there needs to be at least a baseline of skills to be taught for the eHealth team member. So we're looking at those baseline skills and then building on those as building blocks. So starting with a set of baseline skills, we've identified about 160 of those baseline skills, then building more upon those with basic skills, intermediate, advanced, and expert level skills. And then combining those, depending on what your role may be, you may need some or all of those skills, but really looking at what you need specifically to do your work. So we, as Terry had mentioned, what we started looking at when that MOU was found out, was signed 5 years ago, we started looking at what specifically is kind of missing. So we looked at secondary and post-secondary school training. We found gaps in terms of nursing school, medical schools, pharmacy schools. We looked at there needs to be more certification trainings, on-the-job training, refresher training, and advancement training and career development ladder. So technology really is the key to future-proofing this industry. And that's one of the thoughts behind this project. So we're going to talk about how this project started. As Terry mentioned, there were three work streams with this Memorandum of Understanding in 2010: interoperability, workforce development, and ecosystems. Then, as she mentioned as well, that roadmap was signed and it was revised in 2016. And what we did was there was a particularly on the workforce development side, more on the U.S. side, but really on collaboration with CAME and the Global Workforce Development Council and some other groups. What we did was we had workforce development work groups, members from 13 countries met over 20 months. We compiled competencies, mapping those from over 15 source organizations. The result was a mapping of over 1,200 competencies from basic to expert levels, so kind of going along with those levels that I showed you on a couple of slides ago, for over 250 job-specific roles in acute care in 33 different areas of competencies. When we had all those competencies mapped, we had a huge volume of work. We didn't know what to really do with that work except put it into a spreadsheet. So what we did was we instead developed a tool. That tool is called HitComp. That tool is available, and it's available. It's an open source tool, and it's available at hitcomp.org, and I'll show you what that looks like in just a moment. The first phase of that work from that memorandum of understanding ended in 2015, but the work was not done with just that mapping, as Toria has talked about. So more work needed to be done, and the European Commission did launch a new call, and that's where we came together, this consortium came together, and came together under this Societal Challenge Grant, under the 2020 grant. So 6 members of consortium got together, including OmniMicro, HIMSS, as you've been hearing about through the Tiger component of HIMSS, Atel, Volkshochschule Osnabrück in Osnabrück, Germany, Tampere University of Technology, and Steinbeis. These groups came together, and we said, you know, we want to continue the work that's been started, and we want to do more. We do not want to let this end. We want to do more things, and we feel that this is valuable work, and it really has a very important role in making sure that eHealth providers, as well as all actors in the eHealth field, are skilled when they're working. So we put together an idea with 4 work streams. We feel that measuring, informing, educating, and advancing are 4 really important goals that this project is achieving. It's a 20-month project, and it involves research, synthesis, resource and tool development, and finally dissemination related to eHealth and health information technology in the workforce. So what we're doing through those 4 streams, we're doing a significant amount of work. And the first thing that we talked about was a survey. So we started this survey back in February, and Tori mentioned this a little bit. This was a quite comprehensive survey that we began. We had a goal to get 1,000 respondents, and we met that goal. Although we did not have 1,000 responses for every question, we were able to achieve a lot of responses. So we addressed certain things like availability of eHealth courses, certification, gaps, gender disparities. So it was a quite broad and comprehensive survey. Some of the findings were, we had over 1,000 participants. The majority of the participants were from the U.S., although we had a fair amount of participants from Germany, the U.K., and Finland. We showed the results showed there was a positive progress in terms of gender equality. In fact, the majority of respondents were female. The age showed at least 15 to 20 years of career experience overall, and approaching an aging worker category in our results and our respondents. So this is really applicable to who are the workers out there. The responding really showed that they have quite a bit of depth and experience within this industry. Their primary workplace typically showed the likely to have a technology infrastructure, so you've been hearing about that today, and that's very important to have a structure in your workplace that supports not only adoption and integration of electronic health records and interoperability, but really that supports having a workplace that supports your job and your role. So that's what our findings showed. Also showed there were a variety of roles that responded to our survey. You can see the huge number of participants that responded, everyone from ministries of health and education to nurses, pharmacists, engineers, CIOs. We really had the gamut of responses. The majority showed, again, they are aware of gender disparities. However, 42.8% said there were no systems in place to address those gender disparities. So there's still some work that needs to be done. There is a feeling that there is still a significant number of roles, especially in the IT area, that are traditionally male-oriented roles. So those are things that we found within our survey. We put those gaps together that we found, and we will be publishing, as Tori mentioned, an executive summary of our gap analysis coming out this winter. But basically, we came up with 10 gaps. From things that you'll see here on this slide, everything from eHealth knowledge and skills to availability of courses, those are gaps. Adaptation of job descriptions, eHealth infrastructure to some degree was not there, eHealth usage, acceptance and usability of systems, and then again a shortage of health professionals and those gender disparities. So based on those and the feedback and comments that we were able to receive from experts, subject matter experts in the field, the consortium as well as subject matter experts came together with 12 guidelines for best practices. Those guidelines included things like what we need to do is improve awareness of eHealth with continuous training. Actively and continuously include the workforce in development of eHealth solutions, and you just heard this in the last presentation as well. Bridging the gap between ICT and clinicians. Again, the informatics component, making sure that we have medical and health informatics as part of the development. Integrating core eHealth competencies, and this is part of what Tori was talking about in her overview, looking really at those core competencies and seeing how we can expand those to be at all educational levels. Looking at teaching the teachers or train the trainers, really making sure that we pass this knowledge along from all levels. Actively engage and integrate women and other disadvantaged groups. Make sure that we have up-to-date real-world clinical scenarios in what we're teaching, not old things from the 70s and 80s, but making sure that they reflect the 2017s and the 2020s, which we're doing. And I'll show you how some of our deliverables are really reflecting current trends and current things that we can utilize, things such as YouTube, current technologies. And really, finally, the last number 12, promoting this industry of eHealth, so letting others know. How many of your colleagues know what you do and understand that? I still find a lot of people just don't really know what eHealth is. So really promoting the industry, saying what it is, especially in Europe, they really just promoting what the industry is, and I heard in the last session, really making that bridge between the consumer and the clinicians, really making sure that consumers know it's not just about privacy, it's also about really exchanging information, you understanding your own health information. That is so important. So one of the things that Tori had talked about were case studies. We're currently creating case studies to showcase where we have not only examples of successes, but also examples of where we can use some some help in terms of eHealth education, training, skills preparation. We're looking at remedies proposed, concepts identified, and solutions implemented for bridging those gaps. So again, as Toria mentioned, you can go to our website, which is eHealthWork.eu or eHealthWork.org, and there you can actually go and find anything about our project, this website. You can submit a case study, you can become a reviewer, and we're really going to make sure that you get complete accreditation for this as well. So we, as Toria mentioned, we have exemplar samples of your case study, and we will help you to create this. But we're going to have this open call for quite a time. HitComp, which Terry started mentioning about, is very important. This is an interactive, open source, easy to use interactive tool that's used for eHealth digital skills research, education, skills assessment, and career progression. So, what is HitComp basically? If you want to know what you need to be skilled in to be a nurse, what eHealth skills you need, HitComp will tell you. You look up the skills, and then you can also find the education needed to be able to meet those skills. It's a fantastic tool. It was developed out of this memorandum of understanding, and so it's been recently updated. And I invite you to go and explore HitComp today. The address is hitcomp.org. A couple of screenshots. There are over 1,000 competencies, 250 healthcare roles, and it really is one of the flagships of what we've been creating over the past few years. One of the things we're really excited about working on is foundational curriculum. We are in the midst of creating over 60 units of online curriculum, 60 hours of curriculum, foundational curriculum. So if you know nothing about eHealth, you will be able to log on and get free, completely free eHealth curriculum. And we're right in the middle of having reviewers review it and look at this and go forward. Are we running out of time? I'm sorry? Okay. Terry? You would need to leave? Okay. 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 All right. We have a couple of other things that we've done, but I invite you to log on to our website at eHealthWork.eu or eHealthWork.org. You can find out about all of our deliverables to date, as well as all of our events, as well as upcoming events, and you can participate that way. And now we're going to have a question and answer period for you all. Come on up.
Okay, thank you. So, okay, the moderator was a little bit unattentive. Thank you, Rachel, for doing this very nice overview of the project and of the next steps. And I think we have touched all the key principles of the project, so even if I have now stopped you. So, are there any questions from the audience? So, Toria, would you have a comment?
No, I would only repeat what I said before, is that this is a complex thing. You cannot have a eHealth workforce skills and not others. It's like you have to start from somewhere, and then you have a specific skills necessary for the job. I think that it's always the full picture. If a population has to be on the same pace with the skills in order to start using the tools or participate in telemedicine or use the apps, they need the skills as well. But of course, in the hospital, it's a big difference whether you just introduce data into the health record or you do the statistics and you do the research. I think that there are different perspectives at this is in this mapping exercise.
Just speak on.
Yeah, that's a good point. And so that's one of the really good things about HitComp. You can look at a nurse and you can see what specific skills a nurse needs versus an environmental specialist. We have all of these mapped, so you can really see the differences. And what you might assume is that a CIO or a CMIO might need a huge amount of skills, but they may not, because quite honestly, what they need to touch in terms of eHealth may not need to be as much, say, as a nurse. And a doctor may not need as much as an informaticist. So it really is, you know, it's very dependent on what your specific roles are. So you're exactly right. And I actually had a kind of a question, or maybe it's not a question, but in other fields that are not necessarily health-oriented, digital skills, they're playing a large role as well in terms of education. Do you find that they are being taught in, let's say, secondary and post-secondary education enough to really prepare frontline workers for day one entry into their professions for basic ICT type roles more so?
Well, I think that this is exactly what this Digital Skills and Jobs Coalition is looking into, and what I mentioned about this vision about the European education area by 2025, that one of the items to work on is to get these digital skills into and innovation skills into the mainstream education. And then you can go from there according to the needs. And when it comes to the education in the universities of health professionals, then I think that there is a lot depends on who is teaching. Because if the teachers don't have the skills and knowledge, then they are teaching something that is coming from the 20th century. But if the teachers have the expertise and they know the benefits and they are aware of what is needed, then they will go with this subject with the digital skills in it.
Yes.
Because I think that radiology is a radiology whether it is E or without.
Right, right. The trainer. And that's exactly what we have found. I mean, make sure that they have the knowledge to pass along.
I think, just to confirm, I think that's a message that was clearly in the survey. But of course, we have a little bit to find the massive data from the survey. But it was also very much encouraged or underlined when we had this session in Finland in May. We had 4 expert nurses on the panel. And it was really impressive, the remarks that they made. They clearly came to the point that I think that the general education, of course, it can be better and so on, but to have this insightful training and also for a trainer that is who is currently updated on what is needed, and not teaching all, as you just said, not teaching old-fashioned things, but now keeping really pace with the new options that we have for, let's say, medical for the documentation, which is much more challenging now, or maybe also now using decision support tools, electronic ordering, seeing drug interactions and so on. I think that's nothing that is in the general computer's driving license, but that's very specific. And I think with the HitComp's competencies, I think that's a very good tool to underline this.
Yes, and also using, I mean, young people now are used to digital technology. They're used to things like YouTube. So one of the things that the project is rolling out is called instructor demonstrator modules. We're using YouTube, for example, and we're putting ideas for instructors on YouTube so that they can see how you can use this as a teaching module that you can impart to your classes, with both how you can use it as an online curriculum or how you can use it as a classroom-based curriculum. So we're integrating, we're integrating Twitter, we're integrating Facebook, we're integrating the technology and the tools that are out there, because that's where the audience is. in this day and age. They want small nuggets of information. They don't want large chunks. They want little bite-sized pieces, and that's what we try to do too as well in this project.
Okay, I think if there are no further remarks from the audience, I think we can close it here. So thank you very much, Teria. Thank you, Regis. Thank you, Tori. I know that she has left us meantime because she's in her next meeting, but she has been very helpful, so also the preparation. So thank you, everyone, and thank you, the audience. So now it's my pleasure to welcome again Professor Gernot Marx from the University Hospital of Aachen and the president of the German Society for Telemedicine, and he will just make a, I guess, short wrap-up message on the day.
Yes. Yeah, don't be afraid, it won't be long. So thank you very much, Dr. Schug, for organizing this very interesting forum here at the Medica. I think this was very important. We have learned a lot about the European perspective and also in the end about transatlantic perspectives and ideas. And we combined here the very important topics of electronic health records as well as big data. We here in Germany have just launched a very large call on medical informatics. I mean, other countries are further developed than Germany in this respect, but we are addressing now the interoperability, and I think we are on a good way that we are having in the next couple of years here very important success in order to really address the goals we created also today to create this vision for our patients. And I thank you all for coming and discussing and presenting and, as I said, organizing this very important meeting. And I'm looking forward to the next forum at the next Medica 2018. And I feel really that we are on a very good track, and I feel a lot of wind from the back towards the right direction, and in this respect I wish you a nice evening and a good day tomorrow, the last day of the Medica. So enjoy it, and I look forward to see you very soon, and that we will really coming towards our goal that we have really an e-health future and a digital future for our patients. Thank you ever so much. Bye-bye.
Thank you very much.